Hi, my name is Amanda. I'm a St. Thomas University nurse practitioner student. I'm going to be doing my head to toe physical assessment. This is my patient, Leslie. Prior to coming into the room, we've checked her vital signs. We've also performed the vision test, and she's 20 out of 20. To start off, first thing is we're going to be looking at our patient from head to toe just to see if there's any apparent signs of distress. Can you tell me where you are today? What city are we in?
We are in Pembroke Pines, Florida.
What's the date?
Today is December 3rd, 2019.
And what's your full name?
Leslie Palma.
Okay, she's oriented ×3. First thing is I'm going to be looking at her head. Her head is normal for her, it's proportional to her body. There's no visible masses. Her eyes are symmetrical. Her shoulders are symmetrical. First thing is we're going to be palpating her scalp for any masses. Okay, there's no masses. While I'm here, I'm going to be palpating her temporal. Oh. Okay, we're going to be palpating for her temporal artery. Next up, we're going to do her carotid one at a time just to make sure we don't block any perfusion to the brain. And while I'm here, I'm also going to be palpating for her lymph nodes. Okay, cervical. We have maxillary, any pressure, any pain? Okay, we have submandibular. Okay, then we have supraclavicular. Any pain?
Nope.
Okay. Next up, one of the major focus points of the assessment of the head is the eyes and vision. We wanted to make sure that we're performing the Snellen chart just to make sure the patient has good eyesight. Also, we're going to be checking for the peripheral vision. To do that, we're going to be facing our patient. I'm going to just ask you when you see my fingers. Okay, we're going to start here.
See them?
Beautiful. Are they equal?
Yes.
How many fingers?
2.
How many fingers?
2.
Beautiful. Okay, next up I'm going to have you follow me with your eyes on my pen light. Okay. This is the cardinal fields of gaze. Okay, look straight, and then I'm going to have you look past me once I drop the pen light. Okay, and it's appropriate for her eyes to dilate as she looks at an object that's farther away. Next up, we're going to check for constriction. Next. And it's appropriate for her eyes to dilate once the light moves away from it and constrict when the lights go over her eyes. Based off her vision exam, her pupils are equal, round, reactive to light and accommodations. Next up, we're going to be looking at her conjunctiva for any signs of anemia or pink eye. Beautiful. Next up, we're going to be examining her nose just for any foreign bodies or deviated septum. Can you lean your head back? Beautiful. Can you open your mouth for me? Okay, we're looking at her teeth and her tongue or any white patches. Any missing teeth can be contributing to malnourishment. And then we can also see if there are any tooth decays or missing teeth. Next up, we're going to be examining her neck to make sure that her trachea is midline. Okay, standing behind the patient. I'm going to ask you to swallow. Okay, and we're also going to palpate to see if we can palpate the thyroid. There are no enlargements. There's no difficulty swallowing. Just to test her range of motion, can you please just go from side to side with your head, back and front. Okay, down is flexion, and then we extend it, and can you hyperextend? Beautiful. Okay, for the ears, we're going to be assessing just to make sure that they're both equal. They're positioned appropriately. There's no apparent drainage. Is there any pain? What about when I press here? Okay, and to visualize the tympanic membrane, we would pull the pinna back and up and use an otoscope to visualize the tympanic membrane. The next portion of our physical assessment is to assess the patient's respiratory system. One of the first things we do is just visualize our patient's breathing pattern, their rate, effort, the use of any accessory muscles, which is not apparent that our patient is in any distress. Next up, we're looking at her skin just to make sure there's no bluish lips. Any gray skin color could be signs of hypoxia. Next up, we're just going to be palpating. Is there any pain anywhere? Okay. Her thorax doesn't seem to have any abnormalities or deformities. We're going to be auscultating our patient from behind. Can you turn for me? Okay, it's very important to always assess your patient from one side to the other so you have a site for comparison. Take a deep breath. Beautiful. Her lungs are clear. We're looking for any adventitious sounds such as crackles, wheezing, any rhonchi or rales, which could be signs of asthma, pleural effusion. Next up, turn for me. Okay, I'm going to put my hands on the patient's back, and I'm going to ask her to take a deep breath. Okay. Cool. We're just checking for equal expansion of the chest. It's also important to visualize your patient, make sure that they don't have any barrel chest, anything like that would be indicative of COPD. Next up, we are going to percuss our patient's back. Okay, it's very important that we check for diaphragmatic excursion. So when I ask her to exhale, I'd mark that area, and then also mark it when she inhales and measure the distance between. Okay. I'm gonna go. All right. Deep breath. We would mark that area. Okay. Now we're gonna start again. Ask you to exhale. Exhale. And marking the area. The normal distance should be between 3 to 5 centimeters in a healthy female, and that's where she is. Okay, next up, we are going to be percussing for resonance. And we would, like I said, repeat everything that you do on one side, you have to do on the other. So. Okay, once you reach the diaphragm, there should be a dull sound. Any dullness throughout the lung field will be a sign of pleural effusion. The next portion of our assessment is the cardiovascular system. And the first thing that we do is just take a visualization of our patient's chest to see if there's any pulsations, which is not apparent in this patient. We're going to start off first from asking our patient to turn to your left, no, just your head. Oh. Turn your head. There you go. We're looking for JVD, which is jugular vein distension, which would be apparent in our CHF patients. We're also going to be palpating, can you look straight for me? Palpating the carotid. Okay, we're checking all of our pulses. Brachial. Radial. Popliteal. As well as our dorsalis pedis, then keep it straight. And all of our pulses are 2+ throughout. Next up, we're going to be auscultating our patient's chest, which is the most common part of an assessment when you're checking for the cardiac system. We're looking for any additional heart sounds as well as murmurs. In the second intercostal space is where we have our aortic and our pulmonic valves. Okay, at this point, it's our S2 is the loudest. It's in the base of the heart, so it's the farthest part away from the heart. That's why the S2 is the loudest. In the third space, we have Erb's point, where S1 and S2 are equal. Sorry, go. Okay, there we have the mitral valve. I'm sorry, tricuspid valve and mitral. and S1 is the lowest, and we also have the apical pulse. Can you lean forward for me? Thank you. She does not have any additional heart sounds, no rubs, a negative cardiac assessment. The next portion of our physical assessment is a neuro exam. We've already hit a lot of the points when it comes to assessing our patient's neuro status, such as just talking to our patient. It's very important for us to visualize our patient's face as they speak, just to make sure that there's symmetry. If there's any question, you can always ask your patient to smile. Can you puff out your cheeks for me? Are you able to raise your eyebrows? Okay, next up, you can always ask them to shrug their shoulders, just to make sure they're even. Okay. Next up, more focused assessment is to actually perform tests that would tell you if there's any neurodeficits. One of them would be just to check for coordination. Can you touch your nose and my finger? Again. 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 Thank you. Next up, we're going to be checking for lower extremity coordination. Can you touch your heel to shin? And there you go, just like that. Now the next leg. Beautiful. Okay, the next one is to do rapid alternating movement. I'm going to have you have your hands on your lap and just flip them like this for me. Okay, beautiful. And one of the most common exams that we do is called the Romberg. We have our patient stand. Okay, can you close your eyes with your arms to your side? Okay, we have them keep their eyes closed and just test to see if there's any swaying for about 20 seconds, which is not apparent in our patient. While they're standing, you can have them walk just to assess their gait, just to make sure that their hands are moving in synchrony, as well as they're not stumbling over. Nope, thank you. You can have a seat. Alrighty, one of the more detailed exams that we can do is our testing for graphesthesia, is when you just ask your patient to close their eyes, and we draw a number on their hand and ask them to guess the number.
6.
Beautiful. Okay, another one is stereognosis, which would be ask the patient to close their eyes, put an object, and see if they're able to identify the object.
This is a key.
Beautiful. Next up, here, what's this?
This is a pen.
Thank you. That conducts our neuro exam. Neuro and muscular go hand in hand. We're going to be assessing our patient for their muscular status, just to see if there's any apparent signs of malnourishment, such as poor muscle tone, muscle atrophy, which is not apparent. Do you have any pain in any of your extremities?
No, I don't.
All right, I'm just going to palpate your joints. Please let me know if there's any pain. We're looking for any swelling.
No pain.
Beautiful. Next up, which is also a part of our neuro exam, is to test for reflexes. Okay, an appropriate response would be the hand jumping up. Bring your hand back. Bend your elbow. No, just straight back. Like that.
Like that?
No, straight.
Okay.
Thank you. The most common one is the knee one, and there should be a jerk of the leg. Okay, we're going to be testing for range of motion. Can you touch your ear from shoulder to shoulder? Okay, we're going to have for the head of range of motion, can you do circumduction? Beautiful. I'm going to have you flex your arms. That's at the elbows. Extend them. You can also do the same with the wrists. Extend and hyperextend. And with the fingers, you can actually abduct and adduct. And then we also have pronation and supination. Beautiful. And we can also do it with the knees and the hips. So you're going to extend your leg for me. Flex. Beautiful. Okay. We're going to also test for muscle strength. I'm going to ask you to grab both of my hands. We're looking for equal strength, which is straight. Okay, push against me. We're going to pull. Okay, do the same with your legs. Push, pull. Okay, now step in my hands like a gas pedal. Okay, no. Beautiful. The last and final portion of our physical assessment is to do a full assessment of the digestive system. First, we ask our patient to lay down. We become eye level with their abdomen. We're looking for any distension or concave contour, which is not apparent. Those would be signs of malnourishment. Next up, this is the only system that we auscultate before we palpate. We don't want to interfere with any of the bowel sounds. Just gonna put her short. 1 second. We start in the right lower quadrant and we work our way in a clockwise motion. In a healthy individual, you should be hearing bowel sounds in a couple seconds, but it's not abnormal to listen up to 5 minutes per quadrant for bowel sounds. Another portion of the auscultation of the abdomen is to auscultate right in the middle epigastric area, and we're checking using that with the bell of our stethoscope for the aorta. The aorta should be audible, but there should be no bruits present. When assessing for cholecystitis or appendicitis, there's other methods of assessments that we do. One of them is called the Murphy's sign, which you would ask the patient to inhale while pressing the right upper quadrant. Inhale. Any pain?
No pain.
Okay, the other one, we would be checking for appendicitis. We ask the patient if we can press on their left lower side, and they should feel pain in their right lower side.
No pain.
Beautiful. A very important part of our digestive system assessment is to ask your patient when their last bowel movement is.
It was every day.
Beautiful. So our patient's regular. It's very important to ask about their dietary habits, and if they're having any difficulty with their meals, because that could be apparent in other systems as well if they're not eating appropriately. This conducts our physical assessment. Thank you.